Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Hanun Dhea Fahira. People call me Hanun. I'm from Medical Laboratory Technology, Sarjana Terapan. In this opportunity, I would like to presenting the theme of HIV and AIDS. HIV, or human immunodeficiency virus, is a virus that attacks the immune system so that the body's power becomes weaker and susceptible to various disease. Generally, HIV is transmitted through sexual contact to drug use through injection needles. However, the condition can also be spread from mother to child during pregnancy, childbirth, or breastfeeding. There is still a lot of misinformation about HIV that has spread in the community until now. AIDS, acquired immune deficiency syndrome, is a condition in which HIV is in the final stage of infection. When a person has AIDS, the body no longer has the ability to fight off the infection it causes. There are still many people who think that HIV and AIDS are the same condition. Although related, HIV and AIDS are different conditions. You need to know that someone who has HIV doesn't necessarily have AIDS. According to the understanding, AIDS is the final stage of infection with the HIV virus. In this condition, the immune system is no longer able to fight infections that attacks the body. Many people believe that HIV and AIDS can be transmitted through sweat, toilet seats, hugging, and exchanging eating utensils. In fact, all these assumptions are inaccurate, and HIV transmission is actually not that easy. The HIV virus doesn't actually survive long in the open air. So, direct contact with an infected person is the most common mode of transmission. This virus can only be transmitted through blood, female genital fluids, and breast milk that has been infected. HIV and AIDS infection can occur through sexual intercourse either through the vagina or rectum or anal sex. Patients who have been diagnosed with HIV should immediately receive treatment in the form of antiretroviral or ARV, which works to prevent the HIV virus from multiplying and destroying CD4 cells. ARVs work by eliminating elements needed by the HIV virus to multiply and preventing the HIV virus from destroying CD4 cells. There are various types of ARV drugs, including etravirine, evavirance, lamivudine, zidovudine, and also nevirapine. While taking antiretroviral drugs, the doctor will monitor the number of viruses and CD4 cells to assess the patient's response to treatment. CD4 cell count will be done every 3 to 6 months. Meanwhile, HIV RNA examination was carried out since the beginning of treatment. Then, continued every 3 to 4 months during the treatment period. In order for the development of the virus to be controlled, people with HIV must immediately start taking ARVs as soon as they are diagnosed with HIV. The risk of people living with HIV to develop AIDS will be even greater if treatment is delayed, because the virus will further damage the immune system. In addition, it is important for people with ARVs to take ARVs according to the doctor's instructions. Consumption of drugs that are missed will only make the HIV virus grow faster and worsen the condition of the sufferer. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue may occur. Then, the disease is usually asymptomatic until it progresses to AIDS. Symptoms of AIDS include weight loss, fever or night sweats, fatigue, and recurrent infections. Groups of people who are more at risk of infection include: first, people who have sex without a condom, either same-sex or heterosexual. Second, people who often make tattoos or do piercing. Third, people who are infected with other sexually transmitted disease. Fourth, injecting drug users. Fifth, people who have sex with injecting drug users. There are three stages of symptoms in HIV and AIDS. The first stage doesn't cause any symptoms for several years. Patients will experience pain similar to the flu a few weeks after infection for 1 to 2 months. Fever, sore throat, rash, swollen lymph nodes, diarrhea, fatigue, muscle, and joint pain. Second stage generally don't cause further symptoms for years. Viruses continue to spread and damage the immune system. Transmission of infection can be carried out by the sufferer to other people. Lasts up to 10 years or more. Third phase, the patient's resistance is vulnerable, so it is easy to get sick, and will continue to be AIDS. Fever persists for more than 10 days. Feel tired all the time, difficulty to breathing, diarrhea that is severe, and in the long term, there is a yeast infection in the throat, mouth, and vagina. Purple spots appear on the skin that will not go away. Loss of appetite resulting in drastic weight loss. HIV and AIDS prevention. There are various efforts that can be done to prevent the transmission of HIV and AIDS, including: use a new condom every time you have sex. Avoid having sex with more than one partner. Be honest with your partner if you are HIV positive, so that your partner also undergoes an HIV test. Discuss with your doctor if diagnosed with HIV positive during pregnancy about further treatment and planning for delivery to prevent mother-to-child transmission. Circumcision to reduce the risk of HIV infection. And lastly, if you suspect that you have recently been infected or have contracted the HIV virus, such as after having sex with someone with HIV, you should immediately see a doctor. The goal is to get post-exposure prophylaxis or PEP drugs. They are consumed for 28 days and consist of 3 antiretroviral drugs. I think that's all from me. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.